Your feet could be whispering secrets about your health, particularly when it comes to diabetes. This video reveals 10 crucial signs to watch out for, ranging from subtle skin changes to unexpected sensations. Understanding these foot-related symptoms is key to early diabetes detection and management. Dive in to uncover what your feet might be trying to tell you about diabetes. Number 1. Numbness or tingling. Numbness or tingling in the feet, often described as a sensation of pins and needles, is a common symptom indicating potential diabetic neuropathy, a type of nerve damage associated with diabetes. Elevated blood sugar levels over time can damage the delicate nerve fibers in your feet, leading to this unsettling sensation. It's more than just an occasional inconvenience, it's a warning sign. This numbness or tingling can start subtly but gradually becomes more persistent, significantly affecting your ability to feel heat, cold, or pain, thus raising the risk of unnoticed injuries. It's crucial for individuals with diabetes, or those at risk, to regularly monitor their feet for such sensations. Early detection and management of diabetes can prevent or slow the progression of neuropathy. Understanding this link can empower individuals to take proactive steps towards maintaining their foot health, a key aspect of managing diabetes effectively. Number 2. Swelling. As we continue, please subscribe to this channel if you're finding this video helpful. Thank you. Swelling in the feet and ankles, medically known as edema, can be a conspicuous indicator of underlying diabetic complications. In the context of diabetes, this swelling is often the result of poor circulation or damage to the blood vessels caused by consistently high blood sugar levels. When blood doesn't circulate effectively, fluid can accumulate in the lower extremities, leading to noticeable swelling. Additionally, diabetes can impair kidney function, which further exacerbates fluid retention. It's essential to recognize that such swelling isn't merely a cosmetic concern, but a significant health indicator. Regular monitoring for swelling, coupled with effective diabetes management, can mitigate these risks. Understanding and addressing the root causes, blood sugar control, and circulatory health are key. This knowledge not only enlightens individuals about the importance of comprehensive diabetes care, but also emphasizes the critical role of routine foot inspections in preventing severe complications. Number 3. Slow healing sores. Slow healing sores on the feet, a common yet alarming sign for those with diabetes, underscore the disease's impact on the body's healing processes. Elevated blood sugar levels can impair blood circulation and weaken the immune system. This compromised blood flow means essential nutrients and oxygen, crucial for healing, reach the affected area more slowly, delaying the healing process. Additionally, a weakened immune response reduces the body's ability to fight off infections, turning even minor cuts or blisters into potential gateways for serious infections. Recognizing the significance of these slow healing sores is crucial. It prompts not only diligent foot care but also vigilant diabetes management. Regular foot inspections, maintaining controlled blood sugar levels, and prompt medical attention for any foot injuries are vital steps. This awareness empowers individuals to proactively safeguard against more severe diabetic foot complications, emphasizing holistic health management. Number 4. Dry skin and cracks. Dry skin and cracks on the feet, especially around the heels, can be more than just a cosmetic issue for individuals with diabetes. High blood sugar levels can cause the body to lose fluids at a higher rate, leading to dehydration and consequently, dry skin. When the skin is dry, it becomes less elastic and more prone to cracking. These cracks are not only painful but can also become gateways for infections, posing a significant risk given the compromised immune response often seen in diabetes. Furthermore, nerve damage, neuropathy, associated with diabetes can disrupt the natural moisture balance in the skin, exacerbating dryness and cracking. Understanding this link highlights the importance of regular foot care, including moisturizing and inspecting the feet for any changes. This knowledge is a vital part of diabetes management, emphasizing the need for proactive and comprehensive self-care to prevent serious complications. Number 5. Cold feet. Experiencing cold feet can be a subtle but telling symptom in the context of diabetes. This phenomenon is primarily linked to poor circulation, a common complication of diabetes. Elevated blood sugar levels over time can damage blood vessels and nerves, leading to reduced blood flow, especially to the extremities like feet. This impaired circulation means less warm blood reaches the feet, resulting in a cold sensation. Additionally, diabetic neuropathy, or nerve damage, can alter the way the body perceives temperature, making feet feel unusually cold even when they are not. Recognizing and addressing this symptom is crucial. It's not just about comfort, it's about understanding the health of your circulatory and nervous systems. Effective management of diabetes through blood sugar control, regular exercise, and foot care can improve circulation and reduce these sensations. This insight reinforces the importance of holistic diabetes management for overall well-being. Number 6. Changes in skin color. Changes in skin color of the feet, such as red, blue, or pale hues, serve as a visual alert to underlying diabetic complications. These changes are primarily attributed to poor blood circulation, a common issue in diabetes due to damaged blood vessels from high blood sugar levels. When circulation is compromised, it affects the oxygen and nutrient supply to the skin, leading to these noticeable color shifts. For instance, a bluish tint might indicate reduced oxygenation, while redness could signal inflammation or infection. These color changes are not just superficial, they're a window into the vascular health of a person with diabetes. Recognizing and responding to these changes is essential. It involves maintaining blood sugar levels within a healthy range and seeking medical advice for any persistent skin color alterations. This knowledge emphasizes the critical nature of regular foot checks and comprehensive diabetes management for preventing serious complications. Number 7. Loss of hair on toes and lower legs. The loss of hair on toes and lower legs can be a subtle yet significant indication of diabetes-related complications. This symptom is often a consequence of poor blood circulation, a condition frequently associated with diabetes. High blood sugar levels can damage blood vessels, restricting blood flow to the extremities, including the lower legs and feet. Hair follicles rely on a consistent supply of blood to receive the necessary nutrients and oxygen for growth. When blood flow is diminished, hair growth is impaired, leading to hair loss in these areas. This symptom is not just a cosmetic issue, it's a visible clue to the health of your circulatory system. Recognizing this sign is crucial for individuals with diabetes, as it underscores the importance of managing blood sugar levels and maintaining good circulatory health. Regular medical checkups and vigilant foot care are essential strategies to prevent and address such diabetes-induced changes. Number 8. Pain when walking. Pain experienced while walking, often a symptom overlooked, can be a critical indicator of diabetes-related complications. This discomfort, medically termed claudication, arises primarily from poor circulation, a frequent issue in diabetes due to the damaging effects of high blood sugar on blood vessels. This vascular impairment restricts blood flow, particularly to the legs and feet, leading to pain and cramps during physical activities like walking. It's not just an ordinary ache. It's a sign that the muscles aren't receiving enough oxygen-rich blood. Additionally, diabetic neuropathy can contribute to this pain by affecting nerve function in the legs and feet. Understanding this symptom is vital, as it highlights the importance of maintaining good blood glucose control and cardiovascular health. Regular exercise, appropriate diabetes management, and foot care can mitigate these symptoms, emphasizing the interconnectedness of diabetes management and overall physical well-being. Number 9. Change in foot shape. A change in the shape of one's feet, often an overlooked symptom, can signify underlying complications in individuals with diabetes. This alteration in foot structure is typically a result of diabetic neuropathy, where high blood sugar levels damage the nerves. Nerve damage can lead to changes in muscle function and foot alignment, eventually altering the foot shape. This is not just a structural issue, but has functional implications as well. It can affect the way a person walks and can lead to uneven pressure distribution on the feet. This uneven pressure can cause calluses, sores, and even ulcers, especially in areas that bear more weight. Recognizing and addressing these changes early is critical. Proper foot care, appropriate footwear, and vigilant diabetes management are essential to prevent further complications. This symptom serves as a reminder of the importance of comprehensive care in diabetes, encompassing not just blood sugar control but also the health of one's feet. Number 10. Fumble infections. Fungal infections in the feet, particularly common in those with diabetes, are more than just a superficial concern. Elevated blood sugar levels create an environment where fungi can thrive, especially in the warm, moist areas between toes. These infections, such as athlete's foot, manifest as itchy, red, and cracked skin. They're not simply discomforting, they pose a significant risk due to the impaired healing and immune response associated with diabetes. This vulnerability to infection is compounded by potential nerve damage, neuropathy, which can reduce sensation in the feet, making it harder to detect early signs of infection. Understanding this link is crucial. It's not just about maintaining foot hygiene, but also about effectively managing diabetes. Regular foot inspections, good hygiene practices, and keeping blood sugar levels in check are key measures. This insight underlines the broader importance of comprehensive diabetes management for maintaining overall foot health and preventing complications. Recognizing these signs in your feet is pivotal in managing and detecting diabetes early. Regular monitoring, maintaining controlled blood sugar levels, and seeking timely medical care for any foot irregularities are essential steps. Your feet provide valuable insights into your health, making their care an integral part of diabetes management. You might also want to watch this video on 8 common diabetes signs on the skin. And please subscribe to this channel if you found this video helpful. Thank you for watching.